Hello, everyone, and thank you for attending today's webinar, How Can Automation Foster Trust in Healthcare, presented by Proficient and Appian. I'm Rebecca Kushmiter, and I'll be moderating this webinar. Just a few housekeeping notes before we get started here. You can read full speaker bios on the left side of your window by selecting the Speakers tab. For additional resources about today's presentation, click on the Handouts tab button on the left side of your screen. You can access closed captions from the bottom right corner of the video player. This webinar is being recorded. It'll be available to watch on demand within 24 hours. And we would love to hear any questions you have. You can enter those using the questions and answers tab during the presentation or during the Q&A at the end of the session. I'd like to introduce our speakers. We'll be joined by Michael Porter, Principal for Healthcare and Life Sciences at Proficient, David Allen, Senior Solutions Architect, Healthcare and Life Sciences at Proficient, and Matt Collins, Regional Director of Healthcare at Appian. All right, I believe we're ready to begin. So if our speakers would like to go ahead.
All right. Thank you all very much for the time here. I'm David Allen. As Rebecca said, I'm a Senior Solutions Architect at Proficient, and I spend my time living in the world between business transformation and strategy implementation and technology implementations. I'll let my colleagues quickly say a word about themselves, and then we'll dive into the agenda. Mike?
Hey, it's great to meet you. My name is Mike Porter. I'm a principal in our healthcare practice. And much like David, I spend a lot of time talking to clients about how to use technology to meet very specific healthcare needs.
Matt? You're on mute, Matt.
I have to take myself off mute there. I'm Matt Collins with Appian, and I've been with the organization for a little bit over 9 years, focused on our healthcare payer and provider business.
Right, awesome. All right, so we're going to have hopefully a very exciting conversation today, and part of the reason it's exciting is we're trying to kind of square a couple of circles. We all recognize that, and we're going to present an amalgam of some stats around this, that there is a general challenge in the healthcare industry around consumer, patient, member trust. And then we're going to kind of make the connection between that challenge and the role of automation, the role of Appian specifically in certain cases, and the role that we think business transformation plays in the context of that. So that's the goal of this session. We'll spend a little bit of time kind of setting that up and setting up how we want to make that connection and the kind of discussion we want to have. So we'll spend the first 10 minutes or so doing that. Then we'll dive into more of a use case based discussion around where we see automation impacting trust, or the potential for automation to resolve or assist in resolving trust related issues. The big thing I would emphasize is we think that a lot of the trust issues that consumers, members, patients face in healthcare are actually ultimately, at least in a significant way, tied back to silos both in data and silos in processes in healthcare organizations. That leads to the reason why we're talking about automation and business transformation, because automation is a lightweight, low-code way of solving some of those silo issues, especially in the data, but actually also in the processes associated with certain functions. And then we also think that it's really important to think about business transformation best practices. We'll explain what we mean by that as we try to solve those challenges, both with automation and, frankly, with all of the range of technologies that we collectively deploy as we try to make healthcare better. And then we'll try and free up around 10 minutes or so at the end of this to take open questions. So with that, I'm going to jump in and kind of make the case for a challenge of trust. I guess there's probably quite a few people in the audience who would say we don't necessarily need to prove this point, that there is a challenge of trust within healthcare. But I'll say first off, we wanted to kind of just put some big picture stats here. It's actually kind of big picture and small picture, right? On the left-hand side of this slide are some more macro indicators of the kinds of challenge of trust. So on the left there, a Gallup survey indicating nearly a third of respondents cite very little confidence in the medical system. That's a very broad term. but I think we collectively understand that there are a continuing subset, significant minority within our population who just have a general sense that healthcare isn't doing right by them in some way, either isn't accessible enough, isn't clear enough, isn't transparent enough, all of those kinds of things. And over the long term, the numbers move up and down, but the overall perception of excellent and good quality in terms of quality care, insurance companies and physicians is at least flat, if not has been declining by the kinds of numbers that we're showing on the left there. So you have this kind of macro sense that there is a general tension in the industry. And then if you go to more specific detail numbers down in the smaller picture, there are any number of indicators that we have challenges in delivering on trust. So 30% of consumers have delayed or skipped care after finding inaccurate provider information in their health plans transparency tools. So, and then the next stat, around 49% of providers identify that patient errors are a primary cause of denied claims. These are small but important data points, right? So the message here is both at the big picture level and at the small picture level, we have a sense in the wider community that there are things that just aren't quite, that a sense of distrust in healthcare is the message we want to take across from this. When we think about that, we see that trust question manifest in some really obvious ways. This is really just the big picture categories that are, I think, we think are most directly visible and felt by patients and members across the board. So first of all, wanting to be able to have more control and visibility over their actions and impacts in their digital journey, wanting to have comprehensive, up-to-date information across their digital journeys, and wanting to be able to have close to real-time updates on critical information. All of those things are partly as a result of this phenomenon that we've all noticed in the last 10, 20 years even, of an expectation from healthcare that it matches the kind of capabilities in other industries which are typically less regulated, the retail, hospitality, leisure, etc. But this expectation that healthcare should be able to do it. We know that the challenges underlying that are partly to do with the regulatory nature, partly to do with the complexity of the industry. And those kinds of issues are why we think automation is such a potentially powerful part of resolution. That said, across the board, we're also, our patients and members and consumers are also expecting that when we resolve those challenges, we're using their data or their private assets, if you will, to best serve and enhance their digital journey, and they assume that we're doing that, and that's a really key part of the story here as well, and actually a key strength of Appian in particular. So that's the automation and kind of setup of trust. When we talk about business transformation, we wanted to just briefly weave in some mindsets here in that we see that technology initiatives that are driven. We see a majority of, maybe not a majority, but a significant number of technology initiatives that are driven by the kinds of things on the right-hand side, what we think are not how you do transformation. So changes in process that are knee-jerk reactions to a specific issue versus really kind of that are change for the sake of change versus a intentional strategic shift. Short-term fixes, yes, part of the value of automation is the speed of implementation, the low-code nature of it, but a holistic vision of what will contribute is still critical. And technology implementation, yes, any of these is a technology implementation, but it's not just a technology implementation. It's bringing a spirit of continuous improvement to these kinds of opportunity. And then finally, the last couple there, we see often the approach to some of these challenges become a one-size-fits-all, where we assume that one platform will resolve many issues. We know that that's often not the case, and that's a key strength of automation tools, building a lightweight automation architecture around and between platforms where they fall down, and really kind of treating this as an ongoing change management type situation. briefly, before I hand over to Matt to kind of set us up for the kind of the role that we see Appian playing in this space, a quick overview of the process we apply at the outset of any business transformation opportunity. First, we make a big effort to set the broad context of an initiative with an organization's corporate strategy. Second, and this is really critical, we work to assess the given function or team's actual readiness for change. So we don't want to paper over the cracks of something that's an already broken process. Third, we really orchestrate around the user or user groups, be that internal professionals or external consumers. And then where I think the key overlaps with automation in particular land are, we assume an approach of MVP and evolve from there. Think big, start small, and act fast. We assume we seek technical foundations that give the greatest balance between desired functionality and future flexibility. And then we have an approach that emphasizes a focus on data and KPIs.
Yeah, I think I can jump in over the top if it makes sense here.
Yeah.
I think an important consideration for the audience here going forward, and that is, do you have the technology underpinnings to kind of enable these outcome-focused journeys, right?
Absolutely.
And unfortunately, I think, if we kind of move forward on the slides here, one of the challenges that organizations face is that traditional approaches to technology often lead to these friction points, which can start to erode the trust with your patients and or members that are out there. Traditionally, you've got two approaches, right? You can go out and buy packaged software, but that packaged software isn't tailored to your particular business, number one, and number two, it operates within its own silo. So there are kind of, by default, there are going to be gaps in terms of care as you look to put in place a holistic journey that's out there. The alternative is the other end of the spectrum is really custom development. So building out applications from scratch, but those are timely, they're costly to do that, and maybe most importantly is they lead to brittle applications over time. So you end up trying to adapt to change, and those changes then take weeks and months and years in order to get in place. And we think there's a better way. And that's really what low-code automation platforms are all about. So how can I quickly design, build, and optimize business processes, and how do I wrap around that essentially a iterative development approach to get that going? So this slide here kind of highlights some of the key areas that you can impact with automation platforms. Obviously, you can go out and build new applications where you have a gap. A good example of this is like an appeals and grievance system that a customer put up in just 10 weeks to move from a manual process on there. But I think that the other two, the extend and the connect areas, are maybe a little bit more interesting. And to your point, David, I think they tie in, how do you get those application underpinnings all pulled together into a single view? So if you look at extending applications, this is something that we see frequently in the manufacturing space around SAP, or in the payer space around claims and enrollment systems, or in the provider space around EMR systems. You have these behemoth systems of record. They're difficult to change and modify. How do you start to enhance those applications by kind of bolting on around those capabilities? A good example of this actually goes back to the whole COVID pandemic. A major West Coast IDN leveraged a low-code automation platform as they were trying to get the clinical trial of a drug called remdesivir. I don't know if the audience remembers that, but it was one of the drugs that was being tested for its efficacy against COVID. And they needed a way to quickly register potential patients for the trial and assess those patients. And then for those that were accepted, they needed a mechanism to do daily ongoing assessments and then push that data back to the EMR. They were able to build this application in a day. If they'd tried to do that in the EMR, it would have taken months or even years to kind of get that sort of capability out to market. They built it in a day. They rolled it out to 5,000 physicians in Southern California. and they provided more than twice as many clinical trial participants than any other provider in the country. It was actually featured in the New England Journal of Medicine. The other scenario out here is really connecting. How do I start to become this orchestration layer or this digital overlay over multiple applications? The example I always like to use here is one of the largest Blue Cross Blue Shield organizations and their prior author or utilization management process. When we started with them, they had in their provider call center, they had agents with 11 different applications open on their desktop. They had member systems, they had provider systems, they had diagnosis systems, procedure codes, they had Excel, they had a decision tree system, they had Notepad, and they were literally cutting from one application to the other, and then dropping that into this decision tree and then looking up in a 2,000 plus line spreadsheet to determine if they could approve this authorization or if they needed to pend it for review. What we did here was we connected all of those things into a single guided workflow, and the impact was significant. Over 50% reduction in training time for new agents. They saw a 30% drop in average call handling time, and they ended up saving over $1 million a month, and that was something that they actuarially verified. $1,000 isn't quite as impressive,
Right.
So as we go forward, the last thing I want to kind of leave folks with is just kind of as you think about putting in place the underpinnings for automating these journeys and really leveraging automation to streamline those processes with your patients and members. You want to make sure your platform does some key things. Obviously, you want it to be fast to build, so it isn't an undertaking that takes years to get to market. You want it to be something that you can tailor to your business, so you've got the ability to differentiate yourselves out there. It's something that's got to be scalable. It's got to be secure, HIPAA, high trust, all of those kinds of things, especially in healthcare. Protecting the security of that information is critical, as well as enabling you to meet your compliance and regulatory needs out there. Within that framework, then you want to look for opportunities that can really automate those end-to-end processes. How can I drive inefficiency out of the process? How do I reduce those friction points, which ultimately erode trust with your patients and members? Part of that as well, a secondary piece of that is how do I simplify the access to information? In most organizations, as David referenced before, that information is scattered all over. And how do I get a comprehensive view of what's going on without having to go through a massive data transformation or data migration effort? So how can I connect to those systems of record and pull that together to create a unified view? And how do I do that and make that information accessible to end users in a friendly way, whether they're internal users that are accessing things via a web browser, or whether they're external users that are coming in via a portal or even on a mobile device? How do I enable that stuff quickly without having to go through a whole nother development effort? And then I think last but not least is really your ability to change and modify as things go forward. You may have competitive pressures, you might have regulatory changes, you might have a global pandemic out there, or kind of the top of mind issue out there is things like technology change, like AI. How do I leverage all of those components to provide an end-to-end experience for your customers to automate that particular journey?
Awesome. Thank you, Matt.
Yeah,
and I think we'll echo quite a few of those points as we go into this. I think we didn't explicitly treat this session as an AI session, but obviously intelligent automation is in that Venn diagram of automation. So we'll be thinking about that as well. So what we're going to do from here is this is where it gets to be a little bit of the fun. We're going to dive through, obviously. I say automation use cases in healthcare. I really should have said some automation use cases in healthcare. There are hundreds and millions of automation use cases in healthcare. But what we wanted to try and do is, over the next half an hour, we're going to try and cover we've got 6 options. We'll try and cover 6, but we might cover somewhere between 4 and 6, depending on how much fun we're having, of some specific challenge areas. And really what we tried to do is say, look, for each of these, we want to spend what we'll do with each of the items on the right hand side there. So in the patient journey, the topic of referrals and scheduling and health monitoring. In the area of financial transparency, the topics of eligibility and prior authorizations. In provider operations, we'll talk a little bit about revenue cycle, and payer operations we'll talk a little bit about claims management. For each one of those, and we'll probably change the order up a little bit as we go through, I'll spend a bit of time just kind of setting up what we think the challenge is. In most cases, it's pretty obvious what the types of challenge are. Michael and I will briefly talk about some of the technical challenges associated with that, and then we'll let Matt and Mike kind of duke it out on the approach that Appian and automation solutions can take. And then I'll close it out with just a kind of a reference on remembering that some of the business transformation best practices, they apply in all sorts of interesting different ways for each of these. So that's how we're going to approach the next half an hour or so of time. I'm actually going to jump us through to health monitoring because I feel like we want to start there. I think it's some of the most exciting stuff. What I want to do is just, like I said, set up the opportunity here. So this is recognizing that, over the last 10 years, especially in the last 5 years, post-pandemic, we've had a rapidly growing number of digital touch points that patients have with their providers, with their physicians, and frankly, with their payviders. The big picture of what they're engaged with, what types of tools they're engaged with, from apps, virtual health support tools, dietary tools, beyond the pills tools, the number of different touch points that patients have is a little bit unwieldy. And I think as providers in particular, we often see clients have a little bit of a challenge in they have the desire to keep track of and keep a visibility of all of that activity, but some limitations in assuming or making assumptions about how much of that they can bring into one place and have a standardized view. I mean, some of our more advanced clients, yes, have been spending a lot of time on this and have kind of hard-coded some of it. But how do you build some capabilities around that that allow you to have a better view of you and your patient, to have a better view of all of the different digital health tools that they're touching, such that you can really help them feel known and well cared for in their health journey beyond just their interactions with core or legacy care environments. So the way that we've set each of these kind of discussions up, noting the siloed processes and data assets. Obviously, here it's partly an issue that you have a range of disparate digital health and telehealth assets and their associated data, even when it's just activity data, not clinical. An uncertainty of how to leverage that data. Sometimes we've certainly seen weak connectivity between all of those digital health assets and the marketing architecture that a provider has, that would love to be able to tell stories about how their patients are more connected. Obviously, the opportunity for automation is exactly in that kind of extend role that Matt talked about. So we'll poke at that a little bit. And then I'll come back to transformation best practices. But to start the conversation there, Mike Porter, what are some of the challenges that we see from a technical perspective when you think about external solutions that we're trying to kind of get these data points ingested from?
Yeah, and there's a variety of challenges. You always think about it, and you mentioned it before. It's in between these systems. You've got EMRs, you've got claims systems, you've got a variety of systems. In healthcare, you've got claims management, you've got care management, et cetera. And there's always, hey, I gained some key information in one area, but now it just sits. That insight's not actionable. You're not trying to do anything based on it. But what if you could create that dashboard, you could create that information, you could create a flow that says, oh, look, we just had a telehealth process. This person needs additional help beyond just us, providing a prescription or something like that. If it's a provider-based specific use case, How do we actually get into the point where we're providing additional care? How do we get that information to those who can act upon it and create a flow that cuts down that silo? And that's the problem they have right now. You've got a lot of different systems that are very good at the job that they do, but they're not good at transferring or creating an action that will actually create a better outcome for that patient, for that member, et cetera. And this is what you're trying to do, is to break down those silos, whether it be I was in telehealth, I was in some other system, something where you can actually cut down the wall, so to say.
Mm-hmm. And then is that something, Matt, that I mean, obviously we're having the conversation because there's a relevant role here for Appian automation, but
Sure.
it feels like that approach is the beginning of something that Appian can play a role in, and ultimately can lead to what I was calling kind of hard-coded capabilities down the road. But it's that evolutionary phase, right?
Yeah, and I think we see this a lot. I mean, this is an exciting area that I look at as you look at all the remote patient monitoring kinds of applications, et cetera. And one of the challenges is kind of Mike laid out, is all of those operate very well, but independently of one another. And if you're trying to monitor somebody as you're making the case to move someone and move care to home, how do you pull all that together? And when I get an alert, we did something with a payer a couple of years ago where we took a pill box, a connected pill box, and every time there was a medication wasn't taken or somebody opened up the pill box, it would send an alert. But what do you do with that alert, and how do you make it actionable? And that's really, I think, the power of automation, is that you can connect a lot of these remote systems, take those alerts, and then actually have follow-up that's tied to it based on certain rules. In the drug case, for instance, we wanted to see a pattern of not taking medication or not refilling medication to then take action and get a clinician involved. So those are the types of opportunities that I think are that exist, and that automation can really help with.
Mm-hmm. And again, there's definitely a kind of a business transformation mindset here of, you don't need to solve an enormous challenge first. You just need to say, there's a clear opportunity here, like the example you just gave, where there's a piece of information that we have access to that out of context is not particularly valuable, but in context becomes immediately very valuable, and starts to kind of get people thinking about, well, what other pieces of information we've got a connected pill box, what other tools have we got that would generate some of those pieces of information? And before you know it, you're starting to think about it holistically, when each actual piece is a relatively small automation implementation, right?
Yeah, and I think that's one of the. Go ahead, Mike. Sorry.
I was going to say there's an automation. There's a best practice here that you're kind of saying, and if you make it explicit, it's, don't let something that is meant to be a quick hit tool, a tool that solves a problem quickly to get that insight, don't let perfect get in the way of good enough. Mm-hmm. Don't spend so much time saying this one small problem must be completely solved in every single way. I mean, yes, HIPAA, high trusts, all these rules need to apply. But once you've met that core criteria from a functionality standpoint, solve the problem, and don't solve it perfectly, because you're just trying to get to the point where you're giving better trust. And if it takes 5 months to get to something that could have been solved in 3 days, then do it in 3 days.
Mm-hmm. Matt,
yeah,
you were going to say something as well?
Yeah, I was going to say, just to really reiterate that point, I think that's one of the beauties of automation, is that it allows you to act quickly and do that, take that iterative approach, right? Where I can, and especially as this whole segment of the market is evolving in terms of how do I provide care in these environments, you want something that I can quickly iterate on and make changes, and that's where you need that technology underpinning of automation, a low-code automation platform to make that a reality.
Awesome. Well, I'm going to close, as I suspected. We're going long on these, which is great because the conversation's good. But I'm going to quickly close us out on this one. A couple of observations is, we often see clients make relatively hard lines between the kind of marketing funnel side of the patient journey and the patient journey post being a patient. And I think we want to use automation solutions to make sure that we don't have that hard line, that there is a kind of a connection across. And then the other piece here is demonstrating impact of outcomes of better cohesion of digital touchpoints. So when you have a kind of a field of examples like Matt's talking about, the opportunity then is there to say, because we know all of these things, what other pieces of information can we begin to track about our patient base or our member base, and how their utilization or not of those tools improves their outcomes, improves whatever metrics we want to show around those particular people. So I'm going to move back quickly to this one. We're going to cover off referrals and scheduling, just do a kind of a quick pass over this one. I think it's a very familiar space. We spend a lot of time as Proficient with a variety of different technologies looking at this space. But what I wanted to emphasize, maybe Matt here, and kind of having set the framework up, I'd kind of just pick on you to kind of talk a little bit about it, and then Mike, if you have any comments as well, is around often the referral challenges are around interdepartmental, but especially inter-organizational communications processes. So there is, if you happen to be with affiliate entities that have the same EMR and you're connected, maybe some of that gets resolved that way, but obviously there is always a broader challenge in terms of information capture between those entities, between pieces of this that are still manual data entry, the workload that this is associated with crystal clear referral processes. Can you talk a little bit about how Appian, the kind of role that Appian plays there, Matt, and then we'll kind of give this one slightly shorter shrift and move on to the other topics.
Yeah, I mean, this is you kind of mentioned, I still see a lot of referrals being handled via fax and, tracked in spreadsheets and things like that today, right? And I think this is an opportunity where you start to connect the various care parties that are involved in the process, and how do I give visibility into that? And you can start to leverage AI and to do document extraction and things like that to pull data out. But I think that's where automation really comes in, that handles kind of that user experience that I mentioned, and simplifying those user experiences. How do I not only make it easier for the internal folks that are trying to gather the data about that referral, but then how do I pass that via a portal or a mobile notification or things like that to the external parties that are involved? And then how do I keep pace with that to make sure that, I'm engaging somebody and they're actually following up and taking action? And how do I look at over time, who are the partners that we're working with to provide that most comprehensive and positive, journey for the patient or member?
Mm-hmm.
And that's key. I mean, we all know that, referrals and scheduling, for example, referral comes in, there's so many referrals that come in, you've got to act upon it. But the question is what do I act upon? Where should I put my focus? Who should I outreach among all of our teams? And if you're using a combination of insights and AI that come from that, and surfacing that up, and then figuring out, all right, what are the key tasks and who should we be focusing on? All of a sudden, you've made a number of better outcomes in terms of getting these patients the care that they need, even if they have a misunderstanding of the process. Maybe they just need a little bit of a push to get moving, et cetera. There's a lot of ways in which you can use this to create a better outcome.
Awesome. And as we talk through that, I think the one thing, some of the transformation best practices you guys have already talked about a little bit as you go through this. The one thing I'd emphasize that may not be obvious is, I think it should be obvious, but is, that as we know these things and build these capabilities around referrals, the simple task of building referral updates, kind of a breadcrumb or whatever user experience for your patient is so low hanging fruit once you've built some of these things, that it's just, that's the kind of thinking of business transformation, is if you solve the challenge, but make sure that the other party to this challenge, the patient who's trying to understand where they stand with respect to referral, gets a simple heads up, a simple breadcrumb, for example, of where they are in a process, especially when it's outside of your affiliated network. All right. Any other comments? I'm going to move on from this one, folks. All right. So again, I'm going to jump across to a topic that's near and dear to your heart, Mike. I know you spent a lot of time on this, but I think the emphasis here is obviously there is the impact of the mandates associated with prior authorizations, but I think our perspective is that there is a significant opportunity in terms of effectively doing that, effectively using tools, effectively collating and querying multiple third-party APIs that create net new workflow needs that are, exactly the kind of opportunity area that I think automation will excel in, because there is this relatively high reliance still on human and manual follow-ups. How do you track that? How do you capture those pieces of information? How do you connect to Matt's point? How do you extend or connect the capabilities that solve the majority of the problem, but leave a good number of what we might call edge cases intact to resolve? So, Mike, I know you spend a lot of time thinking about solving this with automation and other tools. And what's your perspective here?
Yeah, so if you think about it, and the prior authorization, the mandates that they've got coming out in 2026 are more than just about prior authorization. But if you hearken back to one of the slides of what's the problem, and people talk about the fact that there's authorizations that aren't occurring because of data that's not there, or a misunderstanding of that, and you get a rejection, you waste time. People get frustrated on both sides, as well as, of course, the patient or / member, et cetera. And why is this occurring? It's because you've got systems sitting in a provider. You've got systems sitting at a payer. They're not talking to each other. The payers are desperate to get more information about their members, and the patient records. But what they lack is the ability to either share that information as a payer themselves, and there's the mandate to get them to do a lot more sharing, but also to grab that information from the providers and at the appropriate times. Obviously, a provider is not going to send across every single record. That's inappropriate, obviously, but it should be a lot easier to be able to use a smart on fire application that's enabled by something like Appian that can automate this, that makes it super easy for a transfer of a record that's not a fax, that's not some really hard to create, really hard to set up process tool. Instead, it's using common standards, and that's the key between a payer and a provider. Is you've got HL7, you've got FHIR, you've got DICOM for imaging, you've got a lot of different standards, and you need to be enabled with all of those, and you need to be able to share those in between the payer and the provider to get the best outcome for that patient and member. Those are the key problems, and there's a lot of possibilities here.
Yeah, Matt, there's so much opportunity here.
Yeah, there is. This is an area that we've done a fair amount in, and to Mike's point, I think one of the unexpected benefits that we've seen in our customers is that data collection process. Mm-hmm. And you can think about that today, right? Most of that's manual. They're coming in via fax. They're coming in via, somebody calling, a provider calling a call center, things like that. And by guiding the experience in the collection process of that, one of the unintended consequences is that they found much better information as they started to move through the clinical review, that they didn't have to keep going back. And so that helps streamline that process and goes back to that, how do I create that positive experience for the members, so that I'm building trust in there, and that I'm not rejecting something just because I don't have data and it looks like, oh, you're trying to deny my procedure because you don't want to pay for it, and those kinds of dynamics out there. So I think that's a huge opportunity. And I think as you look at, again, the evolution of technology, as you got smart on fire, things like that, the direct connection from an EMR to the payer, so that they can streamline that even further and leverage things like AI to start to inform the clinicians who are ultimately going to make the decision. You don't want to take it out of their hands and make AI make the decision, but giving them information and relevant information and paring that down so they have just what they need to make those decisions is sort of critical, I think.
Yeah, I think that ties across to the transformation best practices we'd say for this one and for all of them is, once you build that kind of lightweight architecture or overlay, digital overlay, as you talked about earlier, yes, it serves its primary function of making whatever process it is more effective or faster or exist at all in some cases, but it also generates information about the frequency types of issues that occur. So one of the observations here is just to say what of learning that starts to translate into upstream messaging to patients and members about particular types of authorization situations. This looks like X. You're probably going to run into Y problem. How do we make sure that we get ahead of that for you as a patient or member, versus it being a kind of seeming to a patient or member like they've hit an unexpected wall. I literally just got a bill for a COVID test from 3 years ago. So I don't think there was a prior authorization associated, but I just that kind of like, wait, what was that is part of the trust challenge, right?
Yep.
Okay.
And that's an interesting item, because if you think about it, you just got a bill for that, for something that occurred 3 years ago.
Mm-hmm.
While at the same time, we're talking to especially payers, and they're actively trying to find ways to get to the point where they can do real-time claims, where in essence you've got an EOB created before you ever leave the doctor's office. And there's a lot of work that needs to be done for that, but the number of people that we've spoken to that want exactly that, there's a long ways to go in that process, but it all comes down to the sharing of information, the sharing of insights in a HIPAA compliant fashion. But you've got to cut down these silos.
Mm-hmm. I'm immediately starting to think of automation as little synapses inside the bigger picture. But I haven't drawn that slide yet. We'll get there. So same kind of thinking here. I know that we've sort of touched on this by default in Venn diagram form. Prior authorizations as technically a subset of eligibility. But just want to quickly talk about this as a use case in general, because it's one of those areas that is from a patient perspective, not necessarily a rapidly changing space, but there is contractual status is in constantly in flux, especially if you're a larger entity that has multiple different types of physician, multiple different types of sub-affiliate, and multiple very varied payer contracts. So this is a space that like I say, there's a lot of similarities with talking about prior authorization as a topic. But any kind of additional comments you would make on the broader topic of eligibility? I'd pick on you, Matt, to jump in first on this one.
Yeah, the thing that strikes me right off the bat is just around business rules and that orchestration piece of this, because as you're going through eligibility, there's financial eligibility, there's address checks, there's typically a whole series of things that need to be validated. And what happens when I get an error in that process, or something kicks out? How do I resolve that? So you've got to kind of coordinate the steps in the eligibility process, whether it's income validation, state they're in, is there in network out. And I mean, there are tons of these business rules. And if I can start to automate those and coordinate those, I get a much more streamlined process and a better experience overall. So that's kind of the thing that I would call out on eligibility.
Mike?
Yeah,
any other thought?
It's more of the same, pile on. But the funny thing is with eligibility, like any of these other processes, it's where to identify a manual process that takes way too much time, that involves logging into another site. Even if you've got a site that covers all the eligibility for all of your various players for claims and whatnot, you still got work to do before you can figure out what it is, how much it's going to cost, whether some simple things are approved, etc. And the faster you can get to a less of a manual process, then the better off you're going to be. And if you can use a tool that, again, low code, etc., then you're going to make for a better outcome for people. I know I keep using the term outcome, but ultimately that's what you're trying to do, right? take a problem and solve it to get to something that works better. And that's my 2 cents.
Mm-hmm. And if you to bring that across to the transformation is like if you achieve that, again, this may feel like we're kind of going off of topic, but if we're able to do some of the things that we're talking about in these processes, eligibility and prior authorizations, and kind of free up some of that resource time on the payer side and especially on the provider side, what else could you be therefore doing with that freed up resource time that enhances the broader patient journey? We know how much this ties into the broader issue of burnout, both of clinicians and of clinical support staff of all sorts. So it's kind of, again, thinking about the challenge as being, yes, an automation challenge that has XYZ components to it, and figuring out the role in between and extending platforms. But what does that then free up, and how do we talk about that from a KPI perspective? Some of those KPIs are specific to the performance of a given process and improving that. But what other KPIs could we develop that are, because we achieved this, we freed up XYZ resource to resolve any number of other patient challenges. So there's kind of a thinking process there that we need to take. Matt, did you want to say something? You look like you were going to jump in. No. All right. Okay. So we have about 15 minutes left. I propose that we cover the last couple in the same sort of slightly accelerated way, because there are, we'll start to find that once we're talking about any of these topics, they all start to kind of overlap with one another in some form or fashion. Having said that, let's pick something really, really large and complicated: revenue cycle management as a whole. And we know that it's notoriously complicated. It is, in some senses, it is part and parcel of the system that we have in the United States. I've been here for 20 years, so I'm not actually a citizen yet, but I've been here long enough that it's my system too. But because of the nature of that system, there is that broad challenge of revenue cycle, and this is now specifically from a provider operations standpoint. But again, here the life cycle in any given entity is exactly that. You could take your diagram from your introductory comments, Matt, and look at it and say, look, it is multiple solutions and platforms supported by often manual processes for specific entry into them. And then we wonder why there are challenges, right? And so the opportunity is, how do you identify the right kind of solutions in that space? Mike, what are your thoughts right off the bat on this one? I think you're on mute, Mike.
I think you may have muted Mike. Yeah.
I was like, when it gets down to, where are there points between these whole processes that you've got going on? Where are there points in which you're trying to do it and work in one system, then you're trying to work in another system, and how are you going to get to the point where you've shared the information, you've automated certain key tasks, you send information to where it needs to be sent in order to get it done? But Matt, I know you had a huge smile on your face when we hit this, so I'll ask you what you got.
Yeah, I mean, I think you kind of touched on it right there. It's all about information, right? The denials that go on, and the friction that comes is part of the experience for the provider, and the provider journey is, getting that information right, so that things flow through seamlessly. And I think that's always the challenge, right? Because data is scattered. How do I begin to unify that and create a single view of that information, so that I can then share it more effectively? Again, you start to tie in, how do I electronically move that across between payer and provider? But I think it all comes down to data and consolidating that data and connecting that data so that I've got the right information to get those things through, so that folks get paid faster, which is always seems to be top of mind for our customers anyway.
Yeah. And on this one, in particular, I think, one of those emphasis points of continuous improvement, change management, one size fits all not being an issue. All of those transformation best practices apply, especially in this broad use case arena, because this is a never done topic. If we think forward to a future where a substantially larger proportion of our care is delivered in the ways that we kind of envision, digital tools and whatnot, then the nature of revenue cycle will necessarily adapt to those and require updating in everything that we build, from the core platforms to the automation tools that kind of fill in the gaps, if you will. So it's a emphasis of the business transformation best practice of committing to flexible and evolving ecosystems for this one in particular.
Yeah, and I think that sort of highlights the whole idea of getting one of the benefits of automation is allowing it to tailor to your unique environments, right? Every environment's a little different. There are different systems that I'm trying to connect to, and how do I orchestrate all that and pull it together? So.
Briefly then, and again, why not pick something enormous and difficult? But Matt, you alluded in your introduction to some of the kind of specific examples that Appian has here, and obviously as Proficient, we have a lot of experience in supporting our clients in this space. But I think here, when we talk about automation, I'm not going to say it's only about edge cases, but I think here is where you find there are obviously dedicated platforms to accelerate or drive the process of claims management. Every one of our clients has a combination of third party and custom solutions to play the core role, but especially when you think about edge cases, especially when you think about the impact of some of the other things that we've talked about with mandates and prioritization and those kinds of considerations, there is always that kind of 5, 10, 15% edge case environment that you in some ways there is no other effective solution for, that is going to work as effectively as using automation tools to fill in and play that kind of synapse role. I'm going to stick with that term, Matt. I like it, synapse role. But Mike, when you think about this from a technology perspective and the things that we've seen as an organization, what do you see as the technical challenges or specific technology challenges here?
So to keep it short, right, when you talk about claims management, in no way, form, or fashion are you saying an Appian is going to become the claims management tool. What you're saying explicitly is claims management handles all these high volumes. Inevitably, things break. You've got rejections. You've got things that can't be completed. Claims that can't be completed. You've got people who need to work on those problems. And to the extent that you can automate that, and it might be, here's an interface in a workflow that makes it easier to get, and here's a way to request information. Whatever you can do to create a simple application to take care of, as you noted, these edge cases, these things that aren't working correctly, then you've made someone's lives easier. And if your claims management tool or other tools or tools that you use to communicate with providers or whatever the case may be aren't up to the task, then there's an opportunity here to make life easier.
Yeah, I mean, this is a classical case management sort of use case, right? And anytime your adjudication engine kicks out, some sort of exception, as Mike said, humans need to follow up. They need to research it, figure out, and if you can streamline that process and make it simple, you're going to get to resolution faster. Awesome.
We've covered an awful lot of ground. I'm going to take us to kind of some quick key messages. Like we said, the goal was to articulate the silo challenges, both in data and in organizations, and the role that automation can play, and the role that business transformation can play. And we kind of take away 3 big things. The role of automation is to maximize existing technologies and investments. The role is to optimize workflows within and between those major platforms. and to gain new insights generated by that automation. So those are the big takeaways. We want to give a few minutes here for open Q&A. So I don't know if Rebecca's on.
Yeah, what I'll do, and then this is the point for everyone. If you have any questions, just let us know. We'd be happy to take a few questions before the end of the webinar.
Sorry about that. Just took a second to get loaded here. Yes, like you said, we'll move on to the Q&A. You can still submit some questions. And when I see we have a bunch already, we'll see what we can get to before we hit the top of the hour here. What sort of cases have you seen drive the most immediate ROIs or the largest ROIs?
So I think that's a great question. I think is the answer is partly obvious, right? The smaller the kind of the use case, the more easy it is to kind of directly address a KPI. But I want to kind of pass to you, Matt, the response there on immediacy. I think it's a dangerous thing to overpromise on immediacy of ROIs because you still want to do that business transformation mindset as you get into it. But what would you say to the most immediate?
Yeah, I mean, I think the in terms of use cases, we've seen a lot of impact around the prior auth, which we talked about, the whole utilization management piece. But I think it comes in where you're, the biggest impact tends to come where you're starting to automate across groups and departments. So, places there are multiple people involved, multiple systems involved. As you start to connect those dots, there's a ton of inefficiency typically in those areas because people are doing all kinds of things to try to work around the gaps and the friction points. So I think those are the big areas where you start to see where do things cross departments, where do things cross organizations, where is there a lot of data that's scattered, and how do I start to bring that together to drive efficiency and better experiences overall.
All right, thank you. For the next question, what specific KPIs are you using today?
I'll kick that off.
Yeah. Okay.
And the answer to KPIs, and I'm going to give you the consultant answer, but it really is, what problem are you trying to solve? If you've got a claims management problem like one of the use cases that we just had, then the question becomes, well, what's the time to resolution when something fails, right? Or how many failures have you fixed? Or and things like that. It's how much time is being spent, even if the point where you've got automated enough that you have a resource savings, and all of a sudden fewer people are doing the work of more, then you can do it. But ultimately, it's what are you trying to solve, and then what is the indicator that suggests that you're actually making progress in trying to solve that. I wish I could get more specific, but it's going to change for every single problem you're trying to solve.
Yeah, to that end, I think there's vast difference between the use case on health monitoring, where the kind of KPIs that you're looking at are all going to be about how you show better utilization of those tools relative to what proportion of your audience you want to use them. So that's kind of a subset of KPIs specifically around health monitoring, whereas some of the other ones that we're talking about with respect to eligibility and prior authorizations, those KPIs are going to be, to Mike's point, more about how quickly time frame we resolve gaps in knowledge that we can communicate back to the member or patient. Matt, we have kind of 30 seconds left.
Yeah, the other key thing to highlight there is just value realization. By orchestrating and automating these and having visibility into what's going on, you now have a great way to understand what value you're realizing from making these changes, because you now have reporting and access to that info. And I'll leave the
last thank you.
Minutes to go.
We are coming to the end of our time here. We can handle one more question before we have to let everybody go. How does psychological safety play a role in your digital transformation, or does it?
Oh, I saw that come up, and I absolutely want to address it. So It comes up in I would say somewhat indirectly in our we see those kinds of questions arise in our stakeholder sessions at the beginning of setting organizational strategy. So understanding how important those kinds of considerations are and how they flow into organizational change management kind of considerations. That's where we would typically see that type of question emerge. It isn't an area that we have that we specifically treat as a subspecialty area, but it definitely comes up as being a topic in that kind of stakeholder review piece at the beginning of any business transformation effort. Hope that answers the question.
I'll say this,
We'd love to
especially when you're
answer
trying to solve a problem. When you're trying to solve a problem, we have found, and this is now the consultants coming in. You're holding a workshop. You're saying, "What's the problem you're trying to solve?" There's a variety of ways in which you can capture information, and sometimes it's everyone says what they want, but sometimes, especially if you've got large groups, and you've got people who are out there and bold, and they're going to tell you exactly what they think, and then you've got people who aren't necessarily going to speak over those folks. Then the methods that you use should take that into account. Are you using sticky notes for everyone to put that down, and all of a sudden it becomes a voting measure, and everyone can just write something quickly? All of a sudden you've got a more open and efficient manner to gather all sorts of input, even from those that are loud and bold, or from those who are a little more introspective. So you should take into account, when you're trying to solve the problem, the types of people and the amount of constituents you're trying to deal with.
All right. Well, thank you so much. We are at the end of our time here. For everyone who submitted questions, we will try and get back to you personally after the webinar to address those. Thank you all for attending this fierce webinar and submitting the great questions. And I'd like to thank our speakers for participating, and Proficient and Appian for presenting today's webinar. A recorded version will be available to watch on demand. You'll be able to access it within 24 hours using the audience link that we sent to you earlier. Thank you again for joining. We look forward to seeing you at future events.